Hi, I'm Dr. Deborah Garrison with Jake, and we have some important information we'd like to share with you.
Hello, Forbes. Hi,
Hey,
Anna.
Doc, how you doing?
How's everything?
Well, you know, it's not as good as it could be. I'm noticing that Anna doesn't like to jump up on the bed anymore, has trouble getting up when she's lying down too long, and we can't even make it around the block once, can we?
Well, Anna's no youngster anymore, and given her age, breed, and size, I am a little bit concerned about her developing arthritis.
Arthritis in dogs? I know dogs could get arthritis. In fact, I'm not even sure I know what arthritis is.
Well, arthritis is a painful disease of the joints, which can result from either injury or excessive wear and tear or just through years of use. There may be a congenital predisposition, and what happens is we see it as a result of the destruction over time of the smooth cartilage surfaces of the joint, which leaves bone rubbing against bone.
Ooh, sounds painful.
And it can happen in cats and dogs.
Right.
And the degree of aggravation or relief often depends on factors like diet, exercise, and even heredity.
Oh, interesting that you mentioned heredity. You know, her mom had really bad hips.
That is definitely a possibility.
Okay.
Dogs that are born with a condition known as dysplasia are prone to developing arthritis either in the hips or the elbows. Dysplasia itself is pretty painful. Affects usually the larger breeds, but small pets aren't immune. In the case of hip dysplasia, for example, what happens is the bones of the hip joint don't fit together as neatly as possible, which then puts undue stress on the joint and leaving the destruction of the cartilage, and again, bone on bone, leading to pain. You know, unfortunately, with hip dysplasia, there's not a cure, but fortunately, veterinarians have many ways to help our dogs and cats cope with the problem.
Well, so tell me, are Anna's symptoms pretty classic of what you're describing, and is there anything I can do about it?
Well, you're looking at generalized stiffness. We'll see a lot. Trouble getting up after lying down for a long time.
Yes,
Those are pretty
absolutely.
typical. Advanced cases, we can see dogs that are like tremble or even cry when trying to move. Okay. So, you know, that too can present a problem. As far as diagnosis, the best thing we need to do is take some x-rays. We're looking for something called degenerative joint disease.
Okay, well, we will definitely take some x-rays. How about something I can do to make her feel more comfortable?
Well, there are a lot of options we have, which is really great. They range from prescription medication for as anti-inflammatories or pain, to nutritional supplements like glucosamine or MSM, to more natural alternatives now like acupuncture and herbs.
Okay.
It's definitely important, especially in a case like Anna, we need to keep her on the lean side because we want to keep those muscles toned, because toned muscles will definitely help mobility.
Okay, hear that? You and I are on a diet and exercise program. Let me ask you a question. Is there anything that I could have done for her when she was just a puppy?
Well, first we need to see what her problems are. I mean, it's definitely true that there may be a hereditary predisposition, but I have to say environmental factors also play a key role. You know, the advice I usually give puppy parents is to keep them lean, to not overdo the puppy, the high protein rich puppy food, but to maybe just 6 or 7 months of age instead of a year. Definitely want to check with your veterinarian. And lastly, no heavy duty exercise until they're pretty much fully developed, which is about 1.5 to 2 years of age.
Okay, well, I hope that we've come to see you in time because I want to have a wonderful long life with this dog.
And I think we got her pretty early and we can do some good things for her.
Thank you.
Arthritis in our aging pets is inevitable, but not something we should resign ourselves to. Treatment and control options are available for our pets just as they are for us. So why not discuss these with your veterinarian while you're here? Thanks for watching us here on Pet Care Television. I'm Dr. Jeff Werber. We'll be right back.